Hello and welcome. My name is Dr. Rizwan Qureshi, and this is just a quick video in response to a very common question which I get asked, which is a better option, AMC clinical exam or a WBA program? Now, right off the bat, AMC clinical is a clear winner here. In the first round of recruitment campaign, we've seen the people who have passed the AMC clinical have been preferentially given jobs even from overseas in good hospitals, in good training rotations, in major cities and metropolitan regional areas. Now, in terms of comparison, I would say AMC clinical is better. I know it is sometimes perceived to be difficult, but trust me, if you practice it right, it is an easy exam. First of all, from next year, 2024, February up till April, all the exam dates are online and they've largely been filled. The convenience of online exam you cannot deny. You do the exam from your home. You are also preparing through the courses which are all online. Majority of the stations which are taught through the courses and majority of the stations which are tested in the online exam format are all suited to an online teaching and training environment, with the exception of physical examination. But that too can be adjusted easily for an online format. Now, AMC does not release a data of passing rate of online versus the face-to-face clinical exam. But in my experience working with our candidates, AMC online clinical exam has got better pass rate compared to the face-to-face exam. Although I personally like face-to-face exam, but that's the reality that online candidates do give this feedback. They felt more comfortable and they think that exams is much easier to attempt and pass compared to face-to-face. And that could be a variable issue. There might be a level of anxiety when you're doing it face-to-face. So as I said, the first thing is convenience. The next thing is that once you pass the AMC clinical exam, more jobs. You can apply for any state, any hospital, good rotations, and we've seen good example of that. The candidates who've passed AMC clinical have been offered jobs at St. George Hospital in Sydney, Liverpool Hospital in Sydney, Prince of Wales and RPA Hospital in Sydney. Now, these are major training networks in which predominantly the local graduates apply and get jobs. But AMC clinical candidates, well, they get the job there as well. So you're starting off with a very good approach in terms of working in a very good hospital. And then, it's opening up more options of good training schemes afterwards. The next option is that after 12 months of supervised training position in that particular hospital where you've got the job, you can immediately apply for a general or full registration. And that means if you're on visa, you can apply for permanent residency, and straight away you can also join the training scheme. You can right away get into the GP training scheme, AGPT or fellowship support program. You can also join the basic physicians training program. You can also apply for surgical training, emergency training, anesthesia training, or any training that you want to apply for, because general registration provides more options to join the training schemes. Also, the people who have got large career gaps. Now, when I say large, I mean technically more than 3 years. They must do AMC clinical, because that puts heavy weightage on their CV that they have actually passed the AMC clinical, which majority of candidates do not actually pass. So these are my top reasons that this AMC clinical exam is far superior to WBA. Now let's just talk about the WBA program. Now, WBA program is a workplace-based assessment which is job-related. So it's a good tool in which you don't have to pay any extra fee. You get assessed as you're rotating to different specialties in the hospital setting. However, that's where the good news stop. First of all, you need a job for the WBA program to start. And the WBA jobs are not available in every hospital. There are some regional and sometimes even very rural hospitals which would have WBA jobs, and those hospitals too would have a wait time or wait list of at least 12 months or 18 months even to get on to the WBA training program. The other thing is that once you've done the job and you're waiting for 12 months and then finally you take another 12 months to complete the WBA program, that's 24 months, like 2 years or 36 months, or sometimes even 3 years to complete and get yourself to the general registration. So these 3 years you're pretty much lost in terms of joining the GP training or basic physicians training or surgical training or any training that you wanted to do. And if you're on visa, you've lost that important and valuable time getting a permanent registration or permanent residency, that is. So this is very important concept to grapple with. But I think WBA program is good if you can straight away get into it and straight away get on finishing it within 2 years, time frame wise, you can be done with it. But on an average, it takes about 2.5 to 3 years to get out of the WBA program and get a general registration. The other thing I'd like to talk about is cost. Now, AMC exam as of now will cost about $4,391 from next year. Now, people may think it's a lot of fee, but let me just highlight it to you. You're actually losing money when you have not passed the AMC exam, because once you get the job, you actually earn $6,000 per month as a junior medical officer. So compare that fee price to the earning capacity that you're missing out on. And every month you're out of job, you're actually losing $6,000. And as I said, 30% of the people who pass the AMC clinical exam and who've got good credentials are able to get a job anyway. So please do yourself a favor and prepare for AMC clinical and pass the AMC clinical. It is an easy exam as long as you're able to do exactly what is taught in the courses. One of the most important restriction in terms of passing the AMC clinical exam is people rely on videos. So what we are doing here at Emergency Focus from next year onwards, I will be teaching at my own AMC clinical course twice a week, and we'll be practicing lots of cases, every scenario, unless and until I can actually improve your way of history taking, the examination, the assessment, and the communication aspect of management. I think it is a simple exam, and I think with a particular approach, we can strike a right balance to at least pass those 10 stations to get you through. We can certainly do that. So from February onwards, I'll be teaching twice weekly on my own AMC clinical exam to help you get through. Number 2 is that whenever you're preparing for AMC clinical exam, give yourself time for preparation. Give yourself at least 4 months, I'd say. And those 4 months are not just for passive study, it's for active study. As I said, my course is built around practicing the scenario repeatedly over and over again. So in those 4 months, you should be practicing the scenario not only with me, but also with your colleagues and friends. So every scenario should be done at least 2 or 3 times. So hope it makes sense that practice actually makes it perfect. And with simple approach, which is time critical, can help you pass the AMC exam now that is going to be online. So I hope it makes sense. Look after yourself. Let me know if there's any query, info@emergencyfocus.net, and we'll take it from there. Thank you.